My name's Carly Stevens. I'm a third-year medical student at Tulane University in New Orleans, and I'll be presenting on a systematic review of predictors of sunscreen use in United States high school students. So as we know, skin cancer is the most common malignancy experienced worldwide, with the mortality rates associated to melanoma continuing to rise every year. And although the rates of skin cancer are higher among Caucasians, skin cancer in people of color is often found at later stages, and thus it's associated with higher rates of mortalities. And so we really focus on the importance of prevention through education and behavior modification. And dermatologists and general physicians most commonly recommend the use of daily sunscreen to prevent skin cancer. And so sunscreen works by protecting the skin from the harmful effects of UV radiation by blocking them with organic UV absorbers. And without this protection, the UV damage can induce epidermal and dermal DNA damage, which can eventually lead to skin cancer. And so skin cancer prevention and protection campaigns have been designed to educate the public on the importance of sunscreen use. And two programs that we focused on were the sun protection outreach training by students, also known as SPOTS. And this is a program that was created through the partnership of St. Louis University and Washington University in St. Louis, which teaches medical students to educate middle and high school students on the early detection and preventative measures against skin cancer. Another program is Sun Smart U, which was created by the Skin Cancer Foundation. And this allows teachers and educators to download a program that they can present to their students on how to prevent skin cancer. And this age group of adolescents is particularly important because it's estimated that about 40 to 50% of UV damage is done by the age of 20. And so the goal of our review was to summarize predictors of sunscreen use among high school students. And so we have our methods listed, and after a search of Embase, PubMed, and Web of Science, a total of 20 studies met the inclusion criteria for our systematic review. And so some of the results, studies that examined gender showed increased sunscreen use in females compared to males. 5 studies showed increased sunscreen usage in younger adolescents compared to older adolescents. Caucasians were more likely to use sunscreen compared to other ethnicities. Studies showed increased sunscreen use in populations that believe that they are more susceptible to sun damage. And 2 studies examined perceived self-efficacy and concluded that higher levels of sunscreen use were correlated with higher levels of self-efficacy. And finally, 4 studies concluded that increased social or familial use of sunscreen correlated with higher rates of sunscreen use. And so from our review, although skin cancer is one of the more common malignancies in the world, and sunscreen can make it highly preventable, we've seen that this daily use is not routinely followed by everyone, especially adolescents. And so this can be due to beliefs that these people are low risk for skin cancer, low levels of perceived self-efficacy, or low levels of social and familial use. And so these skin cancer prevention campaigns, such as SPOTS, can really benefit from targeting these populations to create a larger impact on changing sunscreen habits. And with the continued expansion of virtual activities such as Zoom, these targeted skin cancer prevention campaigns are possible in more classroom settings. In addition, difficult to reach communities are now becoming more accessible, which allows for the populations who would benefit most from these campaigns to be receiving that information via video format. And these skin cancer prevention campaigns, it's really important that we identify and target these young adolescents who can benefit most from education on the importance of sunscreen use and give them the resources necessary. So, thank you, and I'm happy to take any questions.
All right, thank you very much.